Good evening. In today's coronavirus update, I want to take a look at some numbers, and especially when it comes to the number of people who are dying of coronavirus in India, because there are some interesting possible details hidden behind those numbers. Let's just first start by taking a look at India's ranking in the world. Now, today, India ranks at number 17 in the world when it comes to the total number of cases of coronavirus. But India is at number 19 in the world when it comes to the number of people who've died of coronavirus. Incidentally, in case you're wondering, India is also at number 13 in terms of the number of tests that have actually been done for coronavirus. Now, what does all of this testing and these numbers lead up to? The number of cases per million, because you may well say that, look, India's got a very large population, so whatever the absolute numbers are, doesn't matter. What's the per capita number? So cases per 1 million is 12. There are 12 cases of coronavirus per 1 million Indian. 0.4 deaths per million Indians, which is actually one of the lowest numbers anywhere in the world. But what really caught my attention over the last couple of days is a strange sort of discrepancy that is coming up. Remember, we have heard the ICMR saying that most cases in India are asymptomatic. Now, just park that thought for a minute. Look at another statistic that we have. Globally, there have been 2.5 million cases of coronavirus and around 170,000 deaths. So if you take a look at that, that's approximately 6.8 people dying of every 100 cases of coronavirus. 6.8 people dying for every 100 cases of coronavirus. Now in India, there have been 18,600 cases and about 592 deaths. Now that means 3 people dying, or 3.2 people if you want me to be precise, 3.2 people dying for every 100 cases of coronavirus in India. Now, that's half the global number. So 3.2 people out of every 100 dying in India, 6.8 out of every 100 dying across the world. You could say that testing is bad, or they're not being detected, or so many people are asymptomatic. But that doesn't completely make sense, because if there are lots of cases out there of people with coronavirus or people asymptomatic, so in their houses, it's easier to detect somebody who's dying than detecting somebody who may have coronavirus but is asymptomatic. So actually, poor detection should go in the other direction. It should mean that the number of deaths should actually be higher per reported cases. It's the other way around in India. And there's no clear explanation for this yet. I'm waiting to find some answers. I put this out on Twitter a little earlier in the day, and some people said perhaps the only logical answer I heard is that maybe we're a little earlier in the curve. Lots of recent cases have been detected. Maybe they'll go to hospital and become critical. Let's hope that's not the case, but that's one theory. There could be other theories, some sort of immunity, BCD, something else. I don't know what the answers are, but this is a number that we should track and track very closely. Let's now take a look at all the big stories today.
The total number of novel coronavirus cases in India has surged to 18,601, with over 14,700 active cases in the country. The Indian Council of Medical Research has said that over 4 lakh tests for Covid-19 have been conducted so far in India, and 35,852 samples were tested on Monday alone. The Health Ministry also said India's Covid-19 recovery rate is 17.47% and 3,252 people have been cured so far. But what is worrying is that as per ICMR, 80% of India's positive cases are asymptomatic. But they have assured there is no need to revise testing criteria.
After the Rajasthan government stopped using rapid test kit owing to inaccuracy in the results, the ICMR has asked the state governments to not use the kits for the next 2 days.
आप लोगों ने सुना होगा कि रैपिड टेस्ट किट्स का डिस्ट्रीब्यूशन हुआ सारे स्टेट्स में. कल हमको एक स्टेट में से एक कंप्लेंट आई कि उसमें कम डिटेक्शन हो रहा है, तो हमने तकरीबन 3 स्टेट से आज पूछ लिया. वो पूछने के बाद में हमको एक पता चल रहा है कि उनमें जो पॉजिटिव सैंपल्स थे RT-PCR के, उनमें वेरिएशन बहुत ज़्यादा है. कई जगह पे 6% से लेके जाके 71% जो RT-PCR पॉजिटिव सैंपल्स थे, उनकी ये जो खून के ऊपर जो टेस्ट हुई वो पॉजिटिव आ रही है. ये कोई अच्छी चीज़ नहीं। अगले 2 दिन में हम हमारे 8 इंस्टीट्यूट्स को फील्ड में भेजेंगे और जो किट्स हैं उनमें से वो लॉट्स लेके उसको टेस्ट करके वैलिडेशन करने की कोशिश करें। फील्ड में वैलिडेशन होगा, ये लैब में नहीं होगा। दूसरी बात हमको एक करना है कि सारे स्टेट्स को ये सलाह देना है कि अगले 2 दिन ये टेस्ट किट्स इस्तेमाल न करें। 2 दिन के बाद में हम क्लियर कट एडवाइजरी देने के पोजीशन में रहेंगे।
Rahul Gandhi has slammed Modi government's decision to convert surplus rice in central godowns into ethanol and use it to make hand sanitizers. He tweeted, while the poor are dying of hunger, the government is using their share of rice to make sanitizers to clean the hands of the rich. The centre announced the decision on Monday, saying national policy on biofuels allows the conversion of surplus food grain into ethanol, and central godowns have around 3 times more stock than the existing buffer norms. The ethanol produced from rice will also be added to petrol to reduce emissions. Calling the visit of 2 central teams to West Bengal for an on-the-spot assessment of the Covid-19 situation, Adventure Tourism, the Mamata Banerjee-led Trinamool Congress has asked why such delegations were not sent to states with much higher numbers of infections and hotspots. TMC MPs Derek O'Brien and Sudeep Bandyopadhyay claimed that Chief Minister Mamata Banerjee was informed about the interministerial central team's visit 3 hours after their arrival in the state, which they said was unacceptable.
27 employees of a Tamil television channel have been asked to get admitted to hospital after they tested positive for coronavirus. After a journalist from the channel tested COVID-19 positive recently, coronavirus tests were conducted on 96 employees. Test results for several journalists are awaited. Officials are counselling the family members of those who have been asked to get admitted. The government is working out a 70,000 crore rupee financial package for the power sector that is battling to stay afloat amid plunging cash inflows, sharp drop in bill collections, and unchanged tariffs that are bleeding their balance sheets. Power tariff collections have fallen by nearly 80% in the last monthly cycle, the Hindustan Times reported. Stock markets fell heavily on Tuesday following global fears that took hit from the panic among investors after US crude oil futures sold at negative prices on Monday. The Sensex ended the session falling over 1,000 points and the Nifty dived more than 3% to end the day at 8,981. IndusInd Bank, Bajaj Finance, ICICI Bank, Hindalco and Zee Limited were the top 5 Nifty losers. The Indian rupee settled lower by 30 paise at 76.83 against the US dollar.
National Transporter Indian Railways has shared that it has transported about 1,150 tons of medical items during the lockdown period across the country. This includes medicines, masks, hospital items and other medical commodities. The items were being ferried through timetabled parcel services to support the government's efforts in managing the challenges and the impact of the coronavirus outbreak in the country. Recently, it transported camel milk from Ajmer to Mumbai for an autistic child, and in a similar case, post-surgery medicines for a 16-year-old were sent from Ahmedabad to Ratlam in a parcel train.
The deadly coronavirus has knocked at the doors of the corridors of power in the country. A relative of a sanitation worker at the Rashtrapati Bhavan, which houses the office and residence of President Ramnath Kovind, has tested positive for COVID-19. Although she isn't an employee at the Rashtrapati Bhavan, she lives in the complex. Following her test result, all 125 houses in the Rashtrapati Bhavan complex have been put in quarantine. 25 houses within the same block have been kept under strict isolation. Meanwhile, a senior housekeeper working with the Lok Sabha Secretariat has tested COVID-19 positive and been admitted to the Safdarjung Hospital in Delhi on Tuesday. Reportedly, the infected employee had not attended office for the last 35 days.